You're on, Commissioner.
3, 2, 1.
Okay, welcome everybody. We're here on July 22nd, 2020 via a Zoom link for a Board of Health special meeting, Thurston County Board of Health. My name is Ty Menser. I'm the chair of the Board of Health. We have Commissioner John Hutchings. I see, I don't see him, but I see his name and I see his attendance. I believe Commissioner Edwards is excused from today's meeting. Is that correct?
That is correct, sir.
Okay, we have County Manager Ramiro Chavez. We have Director of Health and Public Health and Social Services, Shelley Slaughter. Our Health Officer, Dimiana Abdul-Malik. We have from Prosecuting Attorney's Office, Jane Futterman. We have several folks from Public Health and Social Services, including Kateri Wimsett, Chris Hawkins, Art Starry, and there is one more box on my Hollywood Squares, 2587.
That's Art's phone number, by the way.
Okay, so I got two Arts. Okay, great. Today's topic for the special meeting is a work session and briefing on something we've discussed in the past, but not been able to take action on because we got waylaid with other concerns. It's a proposed ordinance regarding smoking and vaping in public places and places of employment. And with that, I am going to ask maybe Shelley to take the next step to frame this issue. You're muted, Shelley.
Thank you, sir. Sorry about that. Chris Hawkins is going to start us off.
Very good, Chris.
Morning. Glad to be here, and thank you for taking this time to have a briefing with us about the newly named smoking and vaping in public places and places of employment policy that we've been working on. Starting in 2019, we got approval from the Board of Health to work on this ordinance. It's a local policy that strengthens our community's ability to protect people from exposures to secondhand smoke and vape emissions, and builds on the smoking in public places law of Washington State, which does not include vaping in it. And there's sort of different laws at the state level regarding these two ways of substance use that do impact people's health in our community. So we're going to hear a little bit more about that this morning from Kateri Wimsett, sort of the purpose and aim of this effort. I just wanted to have a quick introduction to where we've been to this point, and also mention a couple of people that will be speaking to you this morning. So we started work on this in 2019, about a year ago, had a initial draft ordinance worked up, and then came back to you in the fall of last year to confirm that we wanted to move forward with this local policy. And at that point, we got confirmation from the board that you were ready to have this go out and be speaking with some of the other local stakeholders about the local policy, namely the other local jurisdictions that would be, their areas would be affected by this policy because it would apply county-wide. It is a Board of Health approved policy ultimately, and so it would have application to all residents in Thurston County, all establishments in Thurston County. So this is a county-wide in its scope, so we wanted to check in with those local jurisdictions, which we did around the end of 2019, and there was very good support among those local jurisdictions for moving forward with this policy. We came back to you in the spring of the year with a briefing in March that Commissioner Menser already mentioned, and this is a follow-up to that March briefing. So I'm going to turn things to Kateri Wimsett to give you a little bit more detail. I'm going to share my screen, if I can, with a PowerPoint slideshow and advance the slides as we need to. I'm going to start that now. If I can find it. And slideshow here.
Thanks, Chris.
Oops. Sorry, I'm partway through it here. There we go. There's the title slide that should have been up here the whole time. I guess I should also mention that another person from environmental health that was not mentioned at the outset, I think Sammy Berg may be joining us this morning for the briefing. Sammy has been one of the main people from our department who responds to those complaints that come in about violations of the Smoking in Public Places law and would be instrumental in the implementation of this ordinance should it pass for our community. So with that, I'll turn things to Kateri to give a little bit more depth on the reasons for the ordinance.
Great, thanks so much, Chris. So just to kind of reframe everything, I know it's been a few months and we've had a few things going on. This is a local ordinance that will restrict vaping in public places. And this is a recommended strategy from the U.S. Surgeon General. It helps really to protect our most vulnerable citizens from secondhand vape emissions. And it also can help to reduce youth vaping. We know that having policies like this can protect people and are an essential part really of protecting community health. I'm gonna have you go to the next slide, Chris. So to give a little bit more background about that basic purpose, starting off, what you've got in front of you here is a graph from our showing a comparison of our 2016 and 2018 Healthy Youth Survey data. So this is data that comes, it's a survey that's given to 6th through 12th graders every 2 years in all schools around the state of Washington. And this is Thurston County specific data. As you can see, we had a very large growth in vaping, and this is matched nationally. The use of vapor products has grown especially quickly among young people. In 2016, we had 12th graders that were about 23% using, and in 2018, that rose to 32%. And we actually had increases in every single grade in those 2 years. And that's a big deal because teens who vape are more likely to start smoking cigarettes later. They're also at higher risk for addiction to other substances. And we know that vaping products appeal to youth because of their design, their flavors, their product names, and they're marketed directly and aggressively to young people. Teens who start vaping are exposed to nicotine, which is the drug, of course, that makes tobacco or cigarettes addictive. And when you introduce a addictive substance to a brain that's still growing, it's very easy to become addicted quickly. And it also, as I mentioned, can raise your risk for addiction later in life. So that brain growth during that time is so important. So we know that preventing youth initiation is really critically important, and having local policies that reinforce the norm of not using and having public use of tobacco and vaping not in public support these kind of prevention efforts. You want to go to the next slide, Chris? Thanks. An equally important area really to talk about has to do with indoor air quality and protecting our most vulnerable citizens. I think, originally when vapes were first marketed, they marketed themselves as just water vapor. And now we've had several years of research and we realized that no, it was never water vapor and never has been. I've talked previously with the board about the thousands of different types of vape flavors that are on the market. And additionally, the numerous different types of devices as well. And really, depending on the type of device and the liquid used, the aerosol that's produced is different. Many of these liquids are very unregulated by the FDA. So vaping exposes people nearby to an aerosol that contains an unknown mixture of harmful and potentially harmful chemicals. And that really puts people at risk, particularly children, pregnant women, and anybody who has a compromised lungs. What you see there on the slide is a CDC infographic of some of the things that they have found. Currently, the FDA has been working through the process to require testing of the substances in e-cigarettes, but it doesn't require that currently and hasn't. So it's hard to know exactly what chemicals are in them. It's very different from cigarettes that have been regulated for many, many years. But some of the things that we do know are in the aerosol include nicotine, ultrafine particles that are those particles that can get really deep into your lung and cause damage. Some of the flavorings that have been found have been diacetyl, which is a chemical linked to serious lung disease. This was the stuff that was in the popcorn lung. volatile organic compounds, some types of cancer-causing chemicals like formaldehyde, and then also heavy metals like nickel, tin, and lead. So it's really not just water vapor in the aerosol, and when it's breathed out, it does go into the air and can affect other people. Chris, I'll have you go to slide 5 then.
You're telling us not to eat cotton candy, Kateri?
Eating cotton candy may be different than inhaling a flavor of cotton candy made up of many, many chemicals. I'm a big fan of cotton candy.
I'm sure it's a very healthy chemical that flavors cotton candy.
So finally, we're back here today to discuss this local option that would be adopting a vaping in public places ordinance. And these kind of ordinance have been adopted in Washington State by 13 other counties. About 75% of the population of Washington State is already covered by these kind of ordinances. When we were here in March, we talked to you about the ordinance in general. And at that time, we kind of ran out of time. We were supposed to come back at the end of March. And now we're back today to do a full discussion about what these options look like. But to kind of frame up the basic things around it, what we're proposing is treating smoking and vaping consistently and trying to prevent the secondhand impacts of both of those. The draft ordinance includes the local adoption of the statewide smoking in public places law, and it would also prohibit smoking and vaping in indoor public places, places of employment, and certain outdoor public places where children congregate, which is like playgrounds, K-12 school grounds. These things are already kind of covered in the law. It would also apply that same 25-foot rule for the presumptive minimal distance from doors and other air intakes or indoor spaces for vaping. That's already true for smoking. And it would require a rule for signage at public places and places of employment. As far as enforcement, it employs our standard approach, which is education first, working with a business owner, and then it specifies what constitutes a civil infraction and what the penalties are. And then there's also a rebuttal process for reducing the 25-foot rule that's included if needed. So I'm actually going to turn it over to our folks who are more than experts on this kind of thing, which is Art and Jane.
Well, thanks, Kateri. And then, this is Art. Art Starry with the Environmental Health Division, and I'll go through things, and then Jane will bail me out if I misstep or forget something. And Kateri did a great job of highlighting the kind of key points for the proposed ordinance. And the proposed, this would actually be a new addition to our sanitary code. It would be Article 8 of the Thurston County Sanitary Code. And as Kateri said, it would help clarify and implement the smoking in public places law, and then also add the new vaping prohibitions. So what I'm going to do is, I don't know if everybody has a copy of the actual ordinance available to them, but I'm going to go through that very briefly. And as I mentioned before, Jane, who deserves most of the credit for writing this thing, is available to help us if there are other questions that come up. So far, so good?
Great.
Yes. Go ahead, Art.
Silence. Good. I put you to sleep. It's 9:30. So the first thing is that if you look at the ordinance, is it actually goes and it amends our existing sanitary code, Article 1, and that's the administrative rules for environmental health processes. And it basically says that you can use the tools that are in Article 1 for violations and enforcement. It establishes that the civil penalties and the civil infractions provisions of Article 1 can be used. And it also goes about setting a fee and identifies or at least recognizes that there's a waiver or a rebuttal process that can be applied for. And so you have, in order for someone to do that, if we want to charge a fee, we actually have to adopt the fee at the time. So that's that first kind of section in the code, in the ordinance. And then attached to that is the draft of Article 8. And it's got several sections of it. I won't go through all of them, but I want to mention a few highlights. And Kateri already brushed us up, but highlighted most of those. So the first substantive thing is...
Pardon me,
Go ahead.
This is Chris speaking. Do you want me to pull up and share the screen of the Article 8?
I don't know if people will find that helpful. Maybe we could do that if you want.
The board members have it in our packet. I mean, obviously we've got lots of people with in different places, but I have it, and I assume Commissioner Hutchings has it. So if you want to make reference to something specific in Article 8, feel free. Okay.
So I'll do that, and then I'll just mention it, and then try to tell people where it is. And if there are questions, we could pull things up on the screen. So the real substantive part of it starts then with Section 3, and that's where we get to the definitions. And as Kateri indicated, the premise of this is to try to make sure that smoking in indoor public places and vaping in indoor public places isn't allowed. Places of employment are protected because we don't want employees to be subjected to smoke and vaping or vapors. And then it also identifies outdoor public places, which are focusing on protecting children. And the actual there are limits as far as what the vaping ordinance can do based on the state law that was passed this past year regarding vaping. So one of the first things I'll just highlight is because one of the focuses is places of employment and employees, as we've defined employee. And this is a modification of state law, and it's trying to address some problems we've had in the past. So that's Section 3.1. And if you look at that, you'll see that in addition to what you might think of as an employee, it also includes an addition that says any individual that volunteers their service. If they're an employee, but they say, okay, I'm going to actually volunteer to do something, and that's going to allow me to work in an area where vaping, a smoking club or vaping or something like that, this would actually say, well, no, you're an employee, and the provisions of this law that are designed to protect employees also apply to you. We've had instances in the past where employee at a facility has said, okay, what I'm going to do is I'm going to volunteer my services for this, and so that way I can avoid the provisions of the smoking in public places law. So this is an attempt to clarify, again, what an employee is and kind of deal with that issue. The next part, substantive part, and Chris identified it there, is Section 3.4, which is what an outdoor public place is. And it defines that, again, as places where children are congregating, and defines that as playgrounds and child care facilities and schools and the like. And it also recognizes that if you have, something that's under control of a membership association, even though, again, there might be a fee, there might be some restrictions on it, if it's allowing non-member guests, then it's considered a public place, and these provisions and the prohibitions and restrictions in the ordinance would apply.
Can we stop right there real quick, Art?
Sure.
So I'm just looking at 3.4. Outdoor public place means the following areas where children congregate that are located outside buildings and are open to the public. So even though the common definition of outdoor public place is a lot broader, it's the actual definition seems focused on where children congregate. Is that accurate?
That's correct. And maybe Jane, if you have a second, you could talk about why it's written that way.
Right. So unlike the smoking in public places law, which allows local governments to have local regulations that are more restrictive than state law, the vapor products law has a preemption section. And what that section says is no political subdivision may regulate use of vapor products in outdoor public places unless it's a public place where children congregate. So we're very restrictive under the vapor products law as to which public places, and specifically the ones listed in the ordinance in the definition in 3.4 are ones that are called out in the state law. So the attempt was to include those places where children congregate, but kind of be consistent with what the state law is anticipating.
So I understand that, but then why do we want to keep thank you, that makes sense, but then why would we keep this really broad sounding definition or label of outdoor public place? Because the public's gonna think we're regulating more than we're actually regulating. We're actually regulating a more narrow subset, and people aren't gonna read it that carefully, and they're gonna think that we're going further than we are.
Well, I guess I have sort of two answers to this. One is, at the time we were drafting this, the legislature had a bill in the last legislative session, which would have rescinded that preemption. And so we thought that bill was likely to pass, and we would have some at least slightly larger authority to regulate outdoor public places with regard to vapor products. And so we had to rein that in when the bill didn't pass the legislature. So that's one reason, and it's kind of a historic drafting issue. But the other reason is that it's a lot easier throughout the ordinance to, when we get to what's allowed, what's not allowed, enforcement authority, all those different things, instead of in each section call out each kind of place, is just refer to outdoor public places. What is and isn't allowed, what are violations or not violations. So we did it that way. We certainly potentially could change it though. I'm not sure we're wedded to calling it outdoor public places. As opposed to places where children congregate, we could maybe change it to that. But we did want to make that distinction between outdoor and indoor because there's very broad authority to regulate indoors. Our only preemption and restriction is limiting what outdoor spaces can be regulated for vapor products. And then I guess the final thing is, given how far the bill went in the legislature this past session, we don't know if we're going to be in a situation, after the 21 session, if they will modify it and eventually pass that bill, or if the state law with the preemption section is going to stay in effect for a long period of time.
Okay, well, thank you. That's a good explanation, and I'm not decided on that yet because obviously I think we're inviting more criticism that we don't deserve potentially. By making it seem like we're going farther than we actually are. So I don't think it's going to be a lot harder for folks to argue with, regulation in outdoor public place where children congregate than just any outdoor public place. So it's something for us to think about. I know it's handy to have a succinct way to say it for drafting the statute, but it may be worth changing it. I don't know.
Right.
Anyway, we can keep going and talk about that later.
Yeah, that makes sense.
Okay, thanks, Jane, and thanks for the questions. So the next thing is place of employment, and so what we were trying to do here is address also some problems we've run into in the past in trying to enforce the smoking in public places law and try to make some sense of things, at least based on our experience, that seem like they should be applied or considered as a place of employment. And so if you read through this, you'll see that it means the place of employment means something that's under the control of an employer, and it's where employees are required to work or congregate or pass through. And then it goes on to describe this as both the physical structures as well as areas within 25 feet of where smoking takes, or ventilation areas and whatnot, ventilation intakes, windows, open areas, and places where people are working. And that's fairly consistent with the state law. It's got the 25-foot setback area. The other thing that we did with this in the second place of employment section, at the bottom of the screen here, is identifying outdoor venues and workspaces that are adjacent to or adjoining indoor place of employment where employees are required to pass through for employment. And that includes food and beverage service areas such as outdoor decks and patios. So that's a clarification of, or actually a bit of an addition to the current language in state law, but we think it makes sense. If you're an employee, you're serving people out on a deck or patio, that you're required to work there. And so smoking, or if the intent is to protect those employees from smoking or vaping in those areas, then this definition makes sense. And so that's why we're proposing it this way, but recognizing it is a bit broader than current state law. Is there anything else you want to add to that, Jane?
Not not at this time, but I'd be happy to answer questions.
Is there from Commissioner Hutchings or?
Well, I have a couple of questions I'm going to save to the very end.
Okay.
I think it's more overarching. Thank you.
The other thing we want to highlight as far as definitions is 311, I think it is, which is the vapor product, trying to define that.
Art, if I could chime in, I guess, yeah, it's now 312 in the version that I think.
Oh, 312, sorry, yeah. My notes, the notes and the slides and everything didn't catch up. We had, one of the things that we forgot to do, and I don't know if Sammy was able to join the call yet or not, but we recognized in drafting this that we forgot to define what THC is. We used the term, but we forgot to define it. So we added that definition, which is, I think, fairly straightforward. But then that moved everything down and added a number. So 311 became 312. And so what we're doing here is trying to show both what is currently defined in some different county ordinance and other counties' ordinances, but actually anticipate what's coming in the future and include things like, or different products. Most vaping products right now rely on some sort of heat source to make the vapor, but there's lots of other ways, if you remember back to whatever physics and science classes you've got, that there's lots of ways to make vapors and lots of very smart and clever people involved in making these products. And so, and Kateri could talk about some of the things that she's found out, but this is a definition that includes different ways of creating vapor, whether it's heating, electronic circuits, whether it's mechanical means, something that might atomize a liquid to make a vapor. And it's, again, trying to anticipate what's coming in the future so that we aren't having to come back to you later on if someone finds a creative way to work around our current definition. And then it later on describes the types of things that might be a vapor product that might look like a cigarette or a nicotine and whatnot. And I believe, if you recall from one of the briefings a while ago, Kateri showed some of the clever products and interesting marketing devices that people have to make people want to buy their products or consider their products. One thing to note, and one of the questions we came up with before is, what happens if, does this include things like inhalers? Well, the last section there talks about what the vapor product is not, which is if it's something that's approved by the Food and Drug Administration, then it isn't covered by this. So if at some point people make vaping products that are approved by the FDA, they would fall outside of this ordinance.
What is the what are we saying about vapor products? I'm looking what are we saying about it that would necessitate your definition there? It includes like parts of an apparatus. I mean, I guess I'm wondering why it has to be that broad if we're trying to stop them from actually, creating vapor in the, like if somebody's got an apparatus at the restaurant and they're kind of disassembling it, just goofing around with it because they got a new one or something, they're not creating. I mean, when it says down here, as well as any parts that can be used to build such products or devices, what are we banning them from? Use in a public,
Well, I think the point is when we're trying to define what someone might use to vape with, they could make it, maybe buy components from the special online vape store, and this, if you can basically have those, they could be considered part of a vapor product. Now, if someone's not using it, then it's not an issue. But I guess I think the intent here was to recognize that it may be like with other things that folks might choose to buy components and basically create a vaping product out of a bunch of different bits and pieces. Is that correct, Kateri?
Does that
She's
mean
nodding her
somebody
head.
could be charged with possession of paraphernalia? Did you get that?
I think. Go ahead, please.
Does that mean somebody could be in violation of the law if they're in possession of paraphernalia?
It would just mean that, again, if someone say someone was vaping with some hodgepodge of things, as the product, it isn't that you have a vapor device, it's whether you're using it in a restricted area. I think that's what this ordinance is trying to do. It's not prohibiting or making vaping products illegal, it's just restricting when they can be used.
Okay.
Or the areas where they can be used. Jane's raising her hand to save me.
Yeah. So the other thing I just wanted to point out, maybe Chris, if you can scroll back up to the definitions of vaping and smoking in the ordinance, so they're on the screen, if you can get both smoking and vaping on, right, there you go. Okay, so 3.8 is smoke or smoking, and that is based on the state law definition of smoke or smoking, which does include carrying, use, or smoking. So it's not only the activity of smoking, but it's carrying and using, but that's what state law says under the smoking in public places law. But if you instead look at 311 in our ordinance, the vaping, we didn't make it as broad. We limited the vaping definition to use or the act of inhaling or exhaling the product. And so that would limit any kind of paraphernalia sort of issue at all with regard to this ordinance on vaping. So we aren't trying to broaden at all, possession or any of that kind of thing. It's really just the act of using those products by inhaling or exhaling them.
All right, thank you, Jane.
If there are any other, those are the definitions I was going to go over. Are there other, what I can do then is start going into the next part of it, which identifies, oops, I've got 2 or 3 different things up on my computer. I got to get back to my notes. So then section 4 is, the ordinance talks about where a public place is and describes, and what prohibitions or limitations there are. And it basically prohibits smoking and vaping in indoor public places and places of employment. And that's, why we've gone to some great effort gone to a lot of effort to define those carefully. Again, outdoor public places where children congregate, and we recognize that there may be a better way to define or have a different term for that. But as Jane was indicating, as far as drafting something it makes it a little bit easier as far as in reducing number of words if we can have a shorter term with a smaller number of words that we can understand. Again, places of employment. It also goes and identifies in section 4.4 kind of who's responsible or who is, I guess, if there's an issue that deals with identifying who's responsible for keeping a place or keeping vaping from taking place that does that. So it says when there's a individual who's been found to be smoking or vaping, then the manager, employer, or other person in charge is present on the premises. There shall be, that basically identifies them as being in charge of the premises. So trying to identify again who's responsible. And, sorry, flipping back between my notes again. And then it also identifies that, again, this doesn't apply to a private indoor space. So if you're in your office, even though you're employed, if you're in a closed area, this doesn't apply to to private indoor spaces, and tries to set that up. The next thing is section 5, and it describes the process, or defines the limitations or the areas where vaping and smoking is prohibited, and it says that it's prohibited within 25 feet of public places or places of employment. And it restricts smoking and vaping within 25 feet of those areas or intake areas. And that's also then where the definition that comes in about, what's a place of employment, and when you include patios and decks and places where employees have to walk or move in order to do their work. It also sets up the process for allowing the waiver for the 25-foot setback. And so, again, if you recall, in Article 1 modifications, it set up a process that allows a waiver to be considered, and that a waiver or rebuttal of the 25-foot setback, and then it also establishes a fee for that. And then it recognizes that coming up, the enforcement section, but also the hearing process that's in Article 1 can be used for consideration of those sorts of appeals or the rebuttal request. Section 6 talks about signs or identifies the signing requirements. And that's pretty similar to the smoking in public places law. So I don't know if there's a whole lot of discussion there, but if you have questions, be happy to try to answer them, or Kateri will. Okay, I got a smile out of her.
I have a question. Art?
Sure.
Regarding signs, I haven't read it thoroughly, but if we're going to ban this from county parks and or trails, how do we sign the trails? Is that the entrance of the trailheads?
So that's basically, it says that you should post signs at prominent locations. So that's basically the entrance and the trailheads.
Okay, thank you.
Commissioner, and
Harry, looks like
I can just jump in. County trails, the Thurston County's trails and parks have already been covered by what you passed a few years ago. But yes,
Okay.
yeah.
Thank you.
Okay, so Section 7 now talks about enforcement. Chris is pulling that up there. And the first thing you want to look at is 7.1. So what we were thinking is that if this ordinance is approved, that we want to have a process where we're using education and outreach at first before we get to the point where we would, if necessary, take more rigid enforcement actions. And so if this is approved, one of the things we'll have to do is figure out what the date is for that blank. Originally, we were thinking of something like a 6-month process for working with the public, informing them, working with businesses and things. And then after that, if someone was in violation and further education and outreach didn't work, then we could take more formal enforcement actions that are described later in this section. So that's an open question there is, do we want to do what 7.1 suggests? And everybody, I think, agrees, especially with our work going on with COVID and everything else, taking on a big new ordinance. Well, we don't anticipate a lot of problems with enforcement. If we get involved with going to court and things, it can be pretty time intensive based on our past experience. So the second part, 7.2, describes the notification and enforcement process, and it basically establishes that we have to go and establish notify the owner or the responsible party, and that we can initiate enforcement actions and include civil infractions and civil penalties. And as we mentioned before, those things are already in Article 1 of the Sanitary Code, and we use them. I think with some success. And I think, again, they would be our preferred mechanism for trying to deal with compliance issues if it's necessary. So I don't know that there's a whole lot more to say about that. Then Section 8 describes the appeal process. And so that, again, goes back to Article 1. There's an administrative hearing process that takes place. We have folks who are basically our code recognizes, or actually you have something that I forget who adopted it. Was it anyways, that are recognized as hearing officers and can conduct hearings. And then the rest of it talks about fees and kind of more of the standard stuff where it's making references to state laws and what happens if someone finds some provision of this ordinance to be not applicable or is considered invalid, that the rest of it stays in place. So pretty standard stuff there.
Art, can you go back on the enforcement section? When you say this is already in the code, are you talking about with respect to our smoking rules? We have the same schedule, is that what you're saying?
I was referring to Article 1 of the Sanitary Code has these provisions in there. The smoking in public places law doesn't have this specific provision.
So there's no penalty scheme.
So for the smoking in public places law, we ended up going through the legal process to enforce the one big case that we had. The smoking in public places law also relies on law enforcement. So it basically gives the health officer and law enforcement the authority to enforce that. And so this basically would give us this administrative process, and the civil infractions and civil penalties mechanism is a way of addressing violations. And Jane might have more to add on that.
Yeah, I guess I'm not sure, Commissioner Manzer, I'm not sure if I understood your question exactly, but basically Article 1 of the Sanitary Code is the broad administrative article, which has provisions that apply to all the other articles on food service, solid waste, septic, all those things. So Article 1 contains the sort of the process. And so it contains the process for how violations are handled, notices of violation, all those sorts of things. So I think what Art meant was when saying it's already in Article 1 is the process for enforcement is in Article 1, but it doesn't have provisions that say what kind of enforcement are for specific kinds of violations. So what we're doing here in this new Article 8 on smoking and vaping is specifying that violations of these things can be civil infractions, but you manage those, you issue them, and they're handled in accordance with the provisions that are already in our administrative sections in Article 1. Likewise, civil penalties, we need to have the dollar amounts of a penalty here in this Article 8, but how the penalties are issued, appealed, decided is all in Article 1 because it's standard throughout the Sanitary Code. If that did not respond to your question, or if you have more questions, I'd be happy to.
Yeah, I mean, these are the types of provisions that draw public attention from businesses or whoever, or people that don't like government fees. So, so I just need to know. It's helpful to know that, for example, if smoking violations have exactly the same penalty scheme, and we're just making it consistent, that would be an easy rebuttal for me to defend what we're doing. If we're doing something different here, I really need to know that, because people will ask why. Is it more, is it going to cost me more to violate the vaping ordinance than it does to violate the smoking ordinance? Is it setting up penalties that, have no precedent? So I'm just trying to get a sense of
Right.
how new is this? How controversial is this? Or how much is this just absolutely aligned to what we've done in analogous contexts?
So yes, it is absolutely aligned with the rest of the code, with very few exceptions. The civil infractions, the vast majority of all violations in the Sanitary Code are Class 1 civil infractions. So if it's a solid waste violation, if it's a septic violation, all those things, those activities, those violations where civil infraction may be imposed, the vast majority of them are all Class 1 civil infractions throughout the Sanitary Code. Likewise, for civil penalties, just like here, we've got this scheme of the first day is $100, $200, goes up $100 a day for each day of an active violation until after 4 days, it continues at $500 for each day. That dollar amount, that penalty scheme is identical for solid waste violations, septic, those other violations specified in the Sanitary Code. So yes, we are absolutely consistent with the rest of the Sanitary Code in terms of the amount or the level of monetary penalty imposed. The one thing I would emphasize, I think Art said this already, is in drafting this, one of the concerns we had is both how it would be enforced, but also resources to do any enforcement. And so in drafting this, although this article in Section 4 makes smoking and vaping in these outdoor and indoor spaces that are defined, it makes it a violation to do the activity. Under this section, under 7.2, the monetary penalties are not for an individual who is smoking or vaping. It's for an owner or manager, basically whoever's in charge of that site. If they're allowing the activity to continue to occur, they're the ones that can have a civil infraction or civil penalty, as opposed to, an individual who, maybe lights up at a playground, that kind of thing. They can still be in violation, but these monetary penalties really have to do with focusing on who should be trying to manage keeping these activities off their premises.
We have 13 minutes left, and Commissioner Hutchings, you have questions.
Yes, thank you, sir. From the moment that we started talking about this, in May 19, we gave direction to PHSS to develop this. My question is, did we initially, when we labeled vaping a scourge on society, did we implement something just just for unincorporated or just for county places, and this incorporates it into the sanitary code, but also makes it countywide, or has it been countywide to begin with? Can you explain that piece to me? Someone.
So at this point, the prohibition is on county parks, correct? And that's what you've done previously. And that's the limitation of it. And then the smoking in public places law, that's a state law that's already in effect, but there is no broader vaping ordinance that applies to Thurston County other than what's in state law for sales and things.
Okay, thank you, Art. And so then, since we banned it from county parks and such, has there been any results that we can demonstrate where it's been reduced or been effective or ineffective, or any measurement, or in fact, have we had any feedback? I see in the document the cities and the local municipalities have supported it, but have we received any feedback from the municipalities since then, or from small businesses that might be impacted by this?
So I can talk a little bit about that. I did outreach to the municipalities in February of this year. So I went to all the town councils and the city councils, and they were supported. They had questions, and really what my plan would be is, if you're going to be moving this forward, to touch back with them, because at that time, of course, we didn't have a draft ordinance to move forward. So I was talking generally about what vaping is, why the county would be considering this, what the basics we knew at that point. I have had chance, I think the last time we met with you in March, you had asked, to do some business outreach, and then we got swallowed by COVID. But in the last 2 weeks, I've had a little bit of time to talk with a few people. I talked with the CEO of the Thurston County Chamber, and I talked with the Downtown Olympia Downtown Association Executive Director, and just basically letting them know that the county was discussing this, that it may be moving forward, but it really was up to the county commissioners, and that we would be doing a public process with this, where we would be doing, our regular due justice to it with a public hearing and that kind of things. And I think, they really wanted more details. And so, my job as a health educator is to go back to them and let them know. But, I think their biggest concern was about, the one concern I heard was about restaurants and bars, and about their outdoor areas. So that was their concern, and they wanted to know what we were going to do around that. And I couldn't answer that at that time, but I, depending on where you go this morning, we'll be able to go back to them, and that would be my plan, to go back to them. And also, it's been a little tough to engage with, because they're very busy and we're very busy.
Yeah.
That is what we've done to this point.
Understandable. And is the only way to measure this as a success is by the youth healthy survey, or is it by the number of civil infractions levied, or is that the only way we can measure its success?
I think it's really hard to measure social norm change.
Yeah.
To be honest. I think it's measured in success when you go out to places. I know I shop locally a lot, so I'm downtown a lot, and I think it's when you can go into places and you don't see people vaping on a regular basis in the evening, when we can gather again and go out to these places. But it takes time. But definitely what the research around these kind of policies do is that it does shift what's acceptable. And I know we've seen that with smoking. I mean, I lived in Pierce County back in the early 2000s. They were the first jurisdiction to adopt the smoking in public places law. They did it locally first. And my husband was serving on the county council, they got a lot of pushback, but that helped to change the social norm. And I think vaping is similar. People have started to do, I know a lot of smaller businesses already don't allow that in their business, but as far as like a mechanism for evaluation of it, that's a difficult, I don't have a good answer for that.
I didn't think you would, Kateri, but you did answer my questions. It'd be fraught with peril to try to gauge the success on the back end by how many fewer youth are engaging health services because of the side effects or long-term effects. Anyway, thank you very much.
I've been thinking about this terminology issue. The best word I've come up with so far is to add the hyphenated adjective youth-oriented. So if you said outdoor youth-oriented public places and put that throughout the statute, I think we'd get a lot less confusion and pushback because we'd be focused on, and if somebody's got a better, more succinct word, I'm not married to that, but that's the best I came up with just sitting here thinking about it. But other than that, I think that I understand all the pieces of it. So do we need to, is the Board of Health being asked then to schedule a public hearing or decide whether we want to move this draft forward, or what's the next steps on this?
Before that's answered, may I comment on what you just said, Ty, and that is, I like that youth-oriented, because if this is directly related to orientation, and the byproduct is adults and such as well, and the comfort of folks around them, it's not, when I read the ordinance, it's not until the 7th whereas that we get down to talking about youth. So I'm glad if we put that in, I think it makes more sense to make it, again, the focus is on kids and health. Then the byproduct is the adults. So go ahead, anybody have an answer to
Maybe
Ty's
Chris,
question?
I don't know, Chris, are you laying out the timeline for what's next?
Well, I was going to invite Shelley to bring this item to a close. What we wanted from the board today is your indication of whether you would like to have this move forward towards a public hearing on the draft ordinance.
So
Shelley,
thank you. Yes, thank you, Chris. So one of the things that we had planned when we last presented this to you, and after we did the stakeholder work with our cities, was to bring this back to you with this additional kind of legal review. And so I think after today, we would like to know if you're comfortable with this language that has been drafted thus far, if there's changes that you need. The next step would be at our regular Board of Health meeting to present this and for you to make a decision about setting a public hearing. We had initially planned, Commissioner Menzer, when we met to talk about the Board of Health agenda, we thought that this might be ready for August. I think we're looking at a more realistic timeline if the board wants to move forward with this for September. So that would be for your consideration today.
I might ask Dr. Abdul Malik, you're being thrust with the responsibility under Section 7 of administering and enforcing it and having responsibilities. Are you comfortable with this draft? You're muted.
I am comfortable with this draft, Commissioner. I've reviewed it pretty carefully, and I feel comfortable that I can that the public need is great enough that I would be happy to play my role.
Got it. Okay. Well, Commissioner Hutchings, do you have thoughts to share? Thumbs up. I'm going to give this a thumbs up to move forward. And it sounds like we have board direction to maybe change that one term to youth-oriented or something analogous to try to let the public know that this is, that this is focused on kids and the statistics there, and I think with that small change, I'm comfortable with what we've got.
Yep, me too.
Yeah, Jane.
So the one other thing that I think we need direction on for the draft is section 7.1, which says that basically that was drafted to allow a phase-in period where enforcement and warnings can be given. So it provides that until a certain date, no other enforcement will be done and only warnings and information. So I guess it would be helpful to have some guidance on how long an educational and warning period you'd like to have before the other provisions go into effect.
I would guess at least 6 months, if not a year, maybe. So if we said till 12/31/21, and then starting in 22, then the enforcement could be operative. How's that sound?
Well, we need a healthy, no pun intended, a healthy amount of time to start educating and get the word out. I think 6 months is plenty of time for that, my opinion.
So we could say 6/30/21, and then 6/7/1, starting 7/1, use of enforcement of this article non-commence until 7/1/21.
Well, I was thinking March. If we adopt this in like in September, 6 months after September, is that March? September, October, November, December, January, February, March, and then so right in the springtime, smack them with it.
In September, you would be setting the public hearing to allow public comment to then review and hear that comment for adoption in potentially October. So you might want to count from October.
So, Shelley, I have a question on that. Is it really for the board to consider setting the public hearing in September? What I'm hearing is perhaps the board may be interested in setting the public hearing in the August meeting.
If that's the will of the board.
I'm just trying to clarify the next steps. And also I think it's two different elements in here. If the board passes this ordinance, the effectiveness or when the ordinance is going to be effective is one, and with the waiting period that you're discussing is another. So whether you like to have the effective ordinance as soon as you pass, or you want to have effective this ordinance January 1st, 2021, and then the 6 months will be coming following that. So that's something that you need to start weighing in is two different steps as to when the ordinance will become effective and when the waiting period will also take place.
I kind of like that. I mean, the education can start immediately, even if the ordinance is effective January 1. You still get that extra time from October, November, December to get the education process rolling, and then 6 months of it being implemented and kind of a grace period for everybody to get used to that.
Yeah, that will be my suggestion is if the board considers to be effective January 1st, 2021, and then the penalties after it will take effect 6 months later, as you discussed earlier. Because I wouldn't suggest for you to, if the board takes an action in October, September, whenever that is, to make this immediate. That will not be advisable from my point of view.
Yeah, I agree.
And as I understood, I like that in August, set it for public hearing in September and start the ball rolling. But I read somewhere there's a DOH money involved in this. Does that include a series of PSA, public service announcements going out in a campaign?
What that money does is it helps to pay for my position. It helps to pay a few things so that we could do some targeted and some communication things around that. I have to be honest, I know as a staff member, I want to speak up and just be clear with you. So many of our staff, are working on so many other things besides, I know every person on this call is also working on COVID issues. And because of that, I would ask for your consideration to consider doing setting the hearing, going to the Board of Health in September. because I know I'm managing much more than just my regular work. And I know everybody on this phone call is. And I feel like having a few more weeks to make sure that I can do good business engagement. It's important to me that when we go out for a public hearing, that people know that we're able to tell them, answer their questions. And I can't turn it around that fast. And I just want to be clear with you about that.
I'm compassionate about with that, Kateri. Thank you for sharing that. And so, yeah, that suits my needs.
And just to elaborate a little bit more on the commissioner comment about the timeline for the BoH funding that we have for tobacco, that runs with the state fiscal year. So we basically just started a new state fiscal year and it runs until next June. And I think this will provide us with some resources, not only for that communication effort that Kateri was mentioning, but also to provide technical assistance to the local businesses about how this new ordinance will affect things, and as well as signage.
Okay, Chris, thank you. We've got to bring this to a close. We have another group of citizens ready for a 10:30 briefing. And so I think you guys have the direction you need. Thank you so much for this morning.
Thank you all for what you're doing very much. Thank you.
Thank you.
Thank you.